parents know their kids best, right? And I think incoming students, those parents or responsible others, if they're not parents, they're caregivers of some sort or guardians. It's about thinking about if there are needs that you know beforehand. That's not only just mental health, that could be academic concerns, is to sort of know what the resources are on campus and how to direct their students to them.
Welcome to Marquette Cares, the podcast that highlights all the ways Marquette is the difference, lights the fire in our students, our community, and our world. My guest today is Brenda Lenz, director of the Marquette Counseling Center. Brenda is a licensed professional counselor and certified substance abuse counselor and serves as the director of the counseling center. She has been at the MU Counseling Center for over 20 years and practicing therapist for close to 30 years. As a therapist, she has a special interest in working with students who want to address more complex mental health issues and those with co-occurring substance use concerns. She uses a combination of motivational and strength-based interventions grounded in a multicultural framework to help students resolve their concerns and live their lives to their fullest potential. As an administrator, her commitment is the delivery of evidence-based, culturally and trauma-informed services for students and is committed to fostering a welcoming, inclusive, accessible, and safe space that allows all students to find support and assistance with a broad range of mental health concerns. Brenda, thanks for being here today.
Of course.
I appreciate it. You and I work together a lot. Once every week, we work together, we talk. So when we started this podcast, you were one of the first people we talked about having on because of the impact that you and the Counseling Center have on the campus. You are probably one of the most important people who provides care for students on our campus. So we thought it was super important to have you on and to talk about it. And also, I can't do my job without you and the Counseling Center. It would be impossible for me to continue. And the support that you give me just as a professional and, as a friend is super important. So I thought we should talk about all the things that the Counseling Center does because it goes unnoticed a lot and you can't talk about it a lot.
Yeah.
So I thought this would be a great way to let people know all the things that the Counseling Center does. So let's talk about the Counseling Center because I think there's things people think you do, there's things you don't do, and there's a lot of things that people don't know you do. So what do you do at the Counseling Center?
Yeah, well, thanks for having me. I always love the opportunity to talk about the work that we do and the team that does it on campus. So I would say we function a lot like a mini mental health unit. So the clinical services that are delivered out of the Counseling Center can range from students who are coming in with developmental concerns like transition issues, relationship stress, all the way on up to students who are struggling with very major mental health and substance use problems. And so our staff are a group of licensed and certified psychologists, social workers, and professional counselors delivering kind of a range of interventions. So college counseling centers are an interesting sort of niche practice. So unlike a traditional outpatient mental health clinic that delivers just therapy, being on a college campus, we do outreach, and we'll talk, I know a little bit about that maybe later. And we do clinical care, and we also do prevention and kind of recovery support. So both clinical things and non-clinical things in hopes of preventing more mental health concerns from happening, as well as supporting students long after they have done treatment.
And you do all that, which, because I have seen it firsthand. And another thing that I have worked a lot to let students know is that you see all students, all full-time students. How do you combat that when students are like, well, I'm not going to pay for that? Who do you see?
Yeah, so it's an interesting model. So we see all students, right? Graduate students, undergraduate students, full-time enrolled, non-full-time enrolled students. Our model has evolved over time. And so we have prioritized just access. That's really important to us. So while we do have a finite amount of resources and we can't see every student on campus for as long as they want or maybe need to be seen clinically, we can have a contact with all students, right? So we have modified our services so that any student at any point can access. So if that's in a critical situation, if that is a student who's wanting to explore what kind of support I need on campus. What could that be? Could that be counseling? We've adjusted our model in order to do what we call it's a first appointment. So students can come in, any students can come in. They come in on their own. They come in brought by you. They come in brought by faculty and staff or parents, sometimes the police department. And a first contact with us is always about like what's going on in the moment, looking to figure out how can we resolve what's going on immediately, and then talking about next steps. So we do a lot of crisis intervention work in addition to kind of individual therapy, but any student can be seen by us. And students who've been seen by us and maybe have stopped care can always come back too. So that's probably the biggest thing to kind of, I think, debunk, is that if students feel like, well, I went there, I transitioned my care out, and now I can never go back, or they won't see me again. The reality is that we will see a student anytime they need to be seen. Now, will we continue to see them long term? Probably not, but we will never not see students. And if students are in distress or students are worried about someone who's in distress, they should always come. So we have a system that can accommodate that pretty immediately.
And I think that's something that people probably don't realize, is that crisis intervention piece that you and I do work together a lot on, is that we do have a lot of students in crisis that people probably wonder, like, what happens when a student is in crisis or a student is threatening to hurt themselves? What do we do? Well, we have trained professionals who assess them in that moment, and that is you all at the counseling center. And we as a university do what you all recommend. So can you walk us through what that looks like? Like, in a hypothetical situation, I bring a student to you who is in a crisis. What does that look like?
Yeah. And I think it's important to define, like, crisis is a pretty relative term too, right?
Yeah.
So if we think about a student who's had a death of a parent that is dysregulating, right? A student who gets a terrible grade on an exam is dysregulating, has a panic attack, that feels like a crisis to them, right? It dysregulates them. And that's all the way on up then through students who are having suicidal crisis or are separating from reality in some ways, and people get concerned about them because their behavior is unusual or different than what they're accustomed to seeing. So anytime a student is brought to us or a student comes in crisis, let's put that in quotations, our first steps are just to do safety assessment, is to figure out in the moment, is a student safe? That is safety for themselves, but it also could be if a student is coming in crisis and it's related to a situation in their lives where they may physically feel unsafe, we're doing kind of a broad-based safety assessment to sort of figure out what's going on. And so in that moment, we're attempting to address the most salient concerns and then creating a plan. And the plans can be encouraging a student to kind of use their coping resource and strength. Maybe within the moment, we talk a lot about distress tolerance, emotional regulation, and it's enough to have a student who's in a panic feel less panicky. And that can also look like getting students connected to care where they are being assessed for a higher level of care because they need a level of care that helps them stabilize themselves. And so that occurs in our office when we're open. And then we have also created an option for students to have that support after hours as well. So we have a service which is designed to feel like an extension of our service. So students can have access to a mental health support specialist 24/7, 365. And that trained person that they have contact with through the phone is very familiar with our services and how to bring students in, but they also can resource them externally too. And so it allows us also next day to take a look at who's accessed and then provide support. And that could be through us. It could be back to a home provider. It could be a contact with a family or a significant other. It could be your office or some other office on campus. So I think counseling centers on college campuses are, again, they're a little different than an outpatient clinic. We have a lot of contact with other people on campus. So we're a resource to students for sure, all students for sure. But we're also there to support faculty and staff who interact with students, who are, all of our business is students. And so when people get concerned about students, we're oftentimes a place that people will call and say, what do you think I should do? Or this is an observed behavior I'm having that's different. Are there some resources or strategies I should employ? And so we want people to know that too, is that, yes, it's about students, but it's also about people supporting students. And so we want them to call.
You do a lot of consulting with, I mean, that's primarily, you and I talk once a week, and you consult with me on every case that I have. You consult with faculty, you consult with other staff, and I know all your clinicians do that on a regular basis, which, again, is something I don't think people realize that you do because it's not something that you advertise. It's just part of the role. But without that, without your expertise of you being the experts in that area, I think a lot of us would be like, well, I don't know what to do in this situation without the students. So we're very fortunate that we have you all there, a phone call away to be like, so I've got this going on. What do you think? I mean, I know for me, it's an invaluable sort of situation.
Right. And I think it is sort of a community. We live and work in a community, right? And so there are things that you do that we don't do, right? And you're an expert in those. Our team are trained clinicians. Our expertise is in how to address mental health concerns, and mental health is, so broadly defined, but we also are, trained to respond to acute distress. But it's also, I think sometimes when other people don't necessarily know what to do and they're concerned, they should just call us, right? Putting your head together with somebody else is always a way to think better about next steps. Because I think we care a lot about what happens to our students, and it isn't just one person's job on our campus to take care of students, right? We all should work together to figure out who can take what part of this so that we all don't feel like we're just holding it all by ourselves.
Right. And because when that happens, that you and I have seen that when that happens, it never works out well.
Right.
And usually that leads to bigger crisis with that student or more problems. So
Right. And probably what's really important, we're mental health clinicians, so our practice is a confidential practice, right? And so the ways we work with students is it's very important that their privacy and their confidentiality is upheld. And if there are issues around imminent dangerousness and safety, I mean, we certainly can make an exception to make sure students are safe. But we do our best work when students are voluntary, when they feel like it's a safe place where they can address their concerns. But not everybody has that same standard, right, of practice. And so that collaboration is critical. And there are ways we certainly work as part of a team by getting permission from students to work. But
that because you, this brings up a good point. You operate under a different set of privacy laws than the rest of the university operates. So higher education operates under FERPA, which is an educational privacy law, and you operate under HIPAA, which is medical privacy laws.
And state statutes.
So that is a completely different set of sort of confidentiality. And in order for me to talk to you about students, I have to have them sign a release of information that's giving me permission. So it is something that you take very seriously. I can attest that you will not, none of your clinicians will talk to me without that student giving me permission or giving you permission to talk to me. So it is something that all college counseling centers, that's how you operate because you're licensed clinicians. And people probably don't realize that we're all just sort of talking to each other and talking about students' business. And that is not how it is. It is a very serious clinical setting.
Right. And I think parents can understand this too, is that we are not sharing information to be difficult or challenging. We're trying to create an environment in which students can talk about things they may not talk about in other places, and gives them a space to do that and resolve them. I mean, I've been doing this a long time. There are when you explain to students that let's get other people involved in your care, right? So I also think a big part of getting better, addressing your mental health stuff isn't just therapy, right? So if a student were to come in and say, I'm really struggling to connect on campus, I mean, there's certainly things we can do in therapy to address the anxiety or whatever keeps them from struggling to connect. But the other part of getting connected is to get out there and connect, right? And to establish relationships. And so that work happens outside of our office. And if there are significant others or parents who it's necessary for them to be part of their care, we talk about it's your medical information, right? It's your healthcare information. And so you should know who we're going to talk to about that and what that is. But the prohibition on students saying you can't talk to anybody about anything, it happens sometimes, but most of the time when we talk about it in the context of a treatment plan, these are the folks we need in the plan, and this is why. I mean, students are very willing to allow us to work together and share what is necessary to share and not all of it. And that's a pretty important distinction. So I think when parents come to campus also, if we treat their students, it's about saying, if you need to be part of that or want to be part of that, talk to your student about that. And it's as easy as signing an authorization that allows us to do that. Mm-hmm. But that has to be originated from the student themselves.
The student, yeah. Mm-hmm. So that's a lot the counseling center does. But what don't you do?
Yeah, I mean, there are certainly limits, right? We are a group of, at full staff, 11 licensed practitioners. We have a couple of trainees who are working toward their degrees in mental health as mental health practitioners. So we have to use our resources in a way that we can see the most students and address the most need. So that means we do time-limited care. I mean, some people call that brief therapy. We really talk about time-limited because we want folks to understand that we're addressing the most immediate concerns and then talking about a care plan. But seeing students weekly for the duration of the time that they are on campus is not a service we provide, nor do we necessarily need to. And if students want that, then we look for ways that they can get that done. So we're also kind of care navigators in a way and sort of figuring out when we're looking to kind of transition a student out of our care, where can they go to do that? And we spend a lot of time figuring out the kind of next best steps. We also don't do therapy that involves frequent contact, like a higher level of care. So that maybe multiple times a week for multiple hours. Those services are specialized services. Those occur outside of a traditional outpatient clinic as well. And so we would work with community partners to get students assessed for a need for higher level of care. We do some medication prescribing. We have a PA with us who does some prescribing, but having students come to campus with existing prescriptions, we don't take those on and resume. We don't do emergency medication stuff or refills. So our prescriber is really part of kind of the care plan when they're in services with us. And so we're able to provide that. I think that's, I'm trying to think what else we might not do. I think that's
And I mean, that would be would you say that's sort of the standard model for most universities and colleges, that this is how they would operate? They're not seeing students for like years.
They are not. Right. And so I think it's just a capacity issue, right? If we saw students for as long as either they wanted to be seen, right? Like I'm a therapist, so I have a bias. I think therapy can be good for anybody. And yet I also believe in like, we can do some good work in the time-limited nature of the care that we have, and then let's talk about the strategy for outside. Other counseling centers, I think, prioritize maybe just triage and referral. Some might do some kind of longer-term work. Just the way that we've strategized and prioritized kind of quick access, it means we want to see students in the moment when they need it and at the time that they're in need of it. And then we can work on those things and then kind of get them connected. We run a group program, and so that also allows students to have care either around a particular topic or clinical concern, or to give kind of skill building stuff to help manage mental health concerns. And that is a way that students can be seen more frequently for a longer period of time, is to move them into group treatment. But yeah, we're a pretty traditional university counseling center model because of just we serve the entire campus.
Yeah, it is a capacity issue. Yeah, I definitely feel that one too. Yeah. And you talked a little bit about outreach before. I was sitting in the counseling center maybe last month with a student, and I saw a little postcard for crafting with counselors, and it like talked about doing a really awesome craft. And I was like, oh, I kind of want to craft with the counselors too. That sounds really fun. So talk about some things that you guys do for outreach like that. That is not just like coming in and talking with one of your clinicians, but you guys do a lot of other stuff too.
Yeah, and outreach is an important part, again, of, I think, because we're embedded on a campus, right? So first of all, want to be out in our community to break down any barriers about stigma, but also how scary it can be sometimes to meet someone and talk about what's personal, right? So we want students to see us also as just people, right, who care a lot about what happens to our students on campus. So outreach is purposeful in that it sort of destigmatizes help seeking. We're hoping it does. It also puts us in community, some groups of students who are more reluctant to engage in care. But we also can do, so we do crafting with counselors, which is one of them. We do that with Resource Center on campus. We also, and we go there, right? So to be in community, sometimes we hold it in our space. We do outreach requests for certain groups. So maybe a sorority wants a particular clinician to come and talk about like trauma-informed response. We do suicide prevention training. We train our student leaders about, they're oftentimes the first place that students may be seen as having a concern. And so we want them to know how to respond to a student in distress. And that's all part of kind of our outreach plan, is how do we put skills in the hands of other people who have direct access to students so that they know the resources on campus, first of all, but when to bring people to us, right? And so we do what we call take a break. We do it midterms and finals. We go with therapy dogs and we interact with students on campus and talk about our services at times when people experience a lot of distress, right?
The therapy dogs is extremely popular.
They love it, right? And that's a collaboration we've done with MUSG over the years and other student groups on campus. And so collaborating with other units on campus is really important. We also, as Counseling Center is clinical services. We also, underneath the kind of clinical care, but not a clinical program, is our collegiate recovery program. It's a peer-based support program. And then we have our prevention and health promotion team who work with peer educators. And so these are non-clinical ways that we do outreach as well. And so to be out there talking about how do you keep yourself well or prevent problems from happening, but also when you run into trouble, which we all do, where are the places on campus we can get support? So outreach is an important part of that, is to kind of arm even our faculty and staff with, like, if a student is sitting in my office in distress, we're not asking faculty and staff to be practitioners or to assess for risk. We just want them to know, like, we're the people you should be calling and bringing students to, and here's how you might be able to motivate a student to come do that. So outreach is an important part of how we want to be in community, and it also is a way to kind of break down, I think, some barriers.
And I'm going to ask you this. We haven't talked about it before, but I think a lot of people would talk about the increase in mental health issues in young people and be like, well, it's on the rise. And since COVID, it's been on the rise. But I think you and I would say it's just been going the way it's been going, and that's how it's going. But what would you say, since you are sort of on the front lines of that with college students, are the biggest issues you see college students facing right now?
Yeah, the biggest issues have for a long time, right, been anxiety, depression, kind of relationship issues. Those tend to be the big three over decades, right? And so I do think anxiety is a big one, and that manifests itself in a lot of different ways, right? And I do think we tend, for years and years and years, we tried to say to the community, right, just reach out for help. So they did, and that's why we saw utilization change, right? So did student concerns, are we having more of them? Probably not. Are students more willing to seek care? Probably. Are the nature of the things that our students worry about or have anxiety about different? Probably. We live in a very different world now. And we think about, like, students' capacity, particularly, our students who have additional struggles, right? They experience anxiety differently. And so that willingness to get help is a good thing, right? At every level of that. When it starts, when it gets more severe or outside of the scope, we do see more students who have had care prior to coming to campus. And so they come to campus wanting to continue their care, right? So it's a hard thing to get a handle on, but certainly as a broad, anxiety is a lot of different things, right? And there's a complexity to what are people anxious about and what other concerns do they have on top of feeling anxious. But that tends to be the thing that most students report.
Yeah, I would say for me, the number one referral I get is heightened emotional distress and anxiety. Those are always the top ones that, we see as a care team. And I usually tell students, everybody is anxious at some point in their lives to varying degrees. Right. It's how, human beings sort of operate. And
I think things within the course of all of our lives, including young people, are going to tax our capacity to cope with them, right? And so how do we normalize that when that occurs, or as you feel that occurring, reaching out for help early is a good strategy, right? Is that we can minimize the impact of just suffering in silence or struggling or waiting till sleep is dysregulated or someone is relying on substances to kind of try to tap things down a little bit. And so having worry and anxiety about certain things is pretty normal, right? So when it starts to interfere or it starts to feel like too much, we want students to access, right? And that's why educating our community about when students show up and are anxious, that's okay, right? And sometimes counseling is the resource you should be providing. It's fine, right? We'll see them. But there are also a wide range of other things that students can do on their own to manage anxiety. And so that's why that kind of the community being knowledgeable about how to help students or how to get them when they feel like they need more is really important.
I think you pointing out the students or people in general being more comfortable asking for help, I think that is true, right? Like I think I don't know if it's a destigmatization or just we're more comfortable asking for help, we're more comfortable with mental health care, but it does seem to be trending that way, that we're more comfortable just admitting like, I'm really anxious, like I can't handle this, I need help. I think that's really important to point out that I see it in our students and I see them hopefully reaching out for help more and more. So I hope we continue to see that.
Right. And I think when parents are looking at colleges with students who are coming in already with mental health concerns, I mean, those are the questions to ask, right? Is what are the campus supports, right, that can provide support for my kid when they're here? Because when you come to college, it's a huge transition in so many ways. And so we would expect a spike in anxiety, or if there was a history of depression or trouble with transitions, we would expect to see them when they come to college, right? And so
and we do.
And we are available in all ways, right? I think about our residence hall staff who see a lot of our first year students. I mean, they report that being something they work on a lot in the first weeks of the semester, or are directing students for support in the early weeks of the semester. So it's just I think we can normalize that that's part of the process, as opposed to like that's a problem that we need to take care of. It's like, no, it just is what it is, right? And if it starts to get in the way, then that's a good time to maybe reach out.
So you did mention parents there. You've been at Marquette for a long time. You've seen a lot. What advice would you give to parents or families of incoming students or current students? What advice would you give them?
Yeah, I think it's about parents know their kids best, right? And I think incoming students, those parents or responsible others, if they're not parents, they're caregivers of some sort or guardians. It's about thinking about if there are needs that you know beforehand. That's not only just mental health, that could be academic concerns, is to sort of know what the resources are on campus and how to direct their students to them. I think students who have an established treatment team for either significant mental health concerns or substance use concerns, is if you can stay with your treatment team through a transition, stay with your treatment team through a transition, right? And that isn't always possible, and I understand that. And we're always a good place to start, right? If you have questions about what can be provided on campus for my kid, then you should call us, right? And we take hundreds of calls from parents throughout the year. So if you have questions about that, please call and ask. I think for students who want to transition their care, either because they have to or they just want closer access to their care on campus, I think we're also a good place to start. Like, what makes sense to do here? What may make sense to start in the community so I can continue with someone for some period of time without interruption? And I think for parents too, it's about, again, you know your kids best. So if you start to see, watch early, look for things that might feel off, and then talk to your students about that, right? And ask questions about what's going on, keeping a dialogue open about that. And then I think when students access care, if parents can support that, that's best. So I think that's what I would say.
No, that's all great advice. And I would second that as well from my perspective too. Super great advice. So as we're wrapping up here, I'm sure you've listened to all the shows because you're a big fan.
Yes.
I like to end with our "we are" moment. As you know, our saying at Marquette, our one of our good sayings is "we are Marquette." Mm-hmm. So I like to think of it as your "we are" moment is a time that you showed care or you felt care, or you just really felt that like Marquette spirit when like we all came together, community, really felt it. So Brenda, what is your "we are" moment?
I think there's been lots of them, right, in the time that I've been there. I think the we are for me is about when our community comes together, we are our best, right? And I think, unfortunately, sometimes that's around critical incident, right? When we have significant incidents on our campus that involve our students, I'm never not impressed with all the folks that are willing to get involved and not only support students, but each other, right? I think it's about when we know that there might be certain people, staff and faculty are really involved in an incident, the ability for other folks, the willingness for other folks to say, is there something that we can do to help your team? Or is there something we can help offload? I think that when we come together as a community, for me, it feels like there's never a better time to feel that. But I think there's small moments too. I think when we work with students who oftentimes have very significant concerns, and sometimes we get a window into that recovery. We get a window into, we see them in their most kind of vulnerable or the time that they struggle the most, and then we see them get better, and that feels really meaningful and important, right? And sometimes we get to be a part of that. But also students come back after some time and say, I really appreciate what you did for me. And that feels really important too, that someone would take the time to acknowledge that something we did made a difference in their life. And so that's what's wonderful about being part of our community, but also feels wonderful about being a practitioner.
Yeah, that's really great. Those are both really great moments. Yeah. So Brenda, thank you for being on here. I really appreciate it. Thank you for talking about mental health and the Marquette Counseling Center. There are so many things that you and your clinicians do that get unnoticed. So I just want to say thank you. You do a lot for me as a, partner, as a team member, as a mentor. You have met with me for, issues that we've had, hard things that I've gone through at the university, and you've been there. You've been like, nope, come over. We're going to talk about it. This is hard. We're going to talk. So I appreciate that so much.
Always.
So we're so fortunate as a university to have you leading the counseling center and your clinicians. Every single one of them are amazing people. Everyone I've talked to has been so much like, what else can I do? What else do you need? So we're fortunate for you. So I know that I could not do my job without every single one of you. So thank you for everything you do.
Yes, of course.
So be sure to listen next month for our first season wrap up. I can't believe it. We've already got one season in the book, when I'm joined by the Assistant Dean of Students, Zabrian Oglesby, as we talk about everything we have learned this season on the show and what we have in store for next season. You can catch that show and all the other shows wherever you listen to podcasts. So be sure to like and subscribe. And remember, Marquette cares.